Hey everybody, Nicholas Snow here with a very special episode of PromoHomo.TV. I'm on location at DAP Health, and I'm telling you in this episode about their free sexual health and wellness services offered here at the main campus in Palm Springs and also at their fairly new clinic in Indio. And as you can see by the sign, they're proclaiming, "We've made more room for judgment-free healthcare. Welcome to the new home of the Orange Clinic." And I'm taking you inside the Orange Clinic in this episode.
The day is coming to an end, and my eyes are drawn to southern skies, but I'll be coming home soon.
And I'm taking you inside the Orange Clinic in this episode, where we're going to learn about their free STI Testing and Treatment, free PrEP and PEP services. They're available for Mpox Q&A. They offer free HIV testing and free Hep C screening. And let's meet the staff people who make it all happen after this. PromoHomo.TV is all about empowering you, our communities, and our world. For their support of PromoHomo.TV, I wish to thank my sponsors. DAP Health. I've been a grateful client of DAP Health for more than a decade. One of their value statements, "We welcome all people, period." Willie's Modern Fare, 1501 Uptown Gastropub, and 849 Restaurant and Lounge. 3 restaurants, unlimited flavors. Shouting out to my media partners. Pink Media, amplifying PromoHomo.TV across the Twitterverse with their #ILoveGay campaign. David Perry and Associates, a PR and marketing firm. GayDesertGuide.lgbt. And KGay 1065 Palm Springs, available worldwide. Ask your smart speaker to play KGAY. And last but not least, the PromoHomo.TV superstars who voluntarily subscribe to the free content at PromoHomo.TV for as little as $1 a month. Join them at patreon.com/PromoHomo.TV. Meet many of them at PromoHomo.TV/superstars. Now here's how you can step up to the plate. To find out how you can help me empower you, our communities, and our world, visit PromoHomo.TV/empower. Thank you. And here to welcome us, we have Mark Desjarnette. Hey, Mark, how are you?
I'm good. How are you, Nicholas?
I'm fantastic.
Good.
So, where are we?
Well, welcome to the Orange Clinic. This is DAP's sexual health clinic, one of 2, and we're in the reception area right now. This is Jadira and Moira. They are our patient reps, and they are the frontline first to deal with our patients. So they always have a smiley face and do an amazing job.
Fantastic. Do you mind if I put you on the spot, Moira? What do you like best about working here?
I think just everybody willing to help patients and supporting them in health needs and equity and making sure they get linkage to care.
And I bet there are people that come here and they breathe such a sigh of relief that the services are even available in a judgment-free environment.
Of course, absolutely. They get really surprised, about the weight of how accommodating we can be, and then the how nice we are and welcoming and very yes.
Well, thank you for your service. And Jadira, what would you like to add? What do you enjoy about your job?
I like being able to help people and getting them the care they need.
Well, thank you for being here. You're very valued and appreciated.
All right, come on back. We'll make a little tour here.
It's a beautiful space. How long has the Orange Clinic been open?
We opened officially on January 9th of this year
Fantastic.
for this location.
Fantastic.
We were over in the other building up until now.
Okay.
All right, so this is one of our exam rooms. This is actually our phlebotomy room, and that's Ruth. She is our lead phlebotomist.
Fantastic. Hi, Ruth. So, how long have you worked at DAP Health?
5 years in May.
So, you were around before they started all the dramatic expansion and construction, and now they've evolved, and you're in this brand new clinic. How is that for you?
I think it's great. It's much bigger. We're definitely more with the other clinics now as opposed to like space-wise. So I think that it just broadens our space to see more patients, and just everybody's all together now in all the clinics.
What inspired you to get into healthcare?
Personal experiences that I had that I wanted to become as great as the nurses made me feel when I was in a time of need, pretty much.
That's beautiful. And how is it for you to actually be here and to be able to offer these services?
It's very rewarding, especially with the community that comes through here. Very open-minded, very fun, and just very lively. So I love working here, and I think this is a great space for anybody who wants to have judgment-free healthcare to come to.
Well, it's really nice to meet you, and thank you for your service.
And Ruth is also in nursing school right now to become an RN. So she's going to transition from phlebotomy to an RN and probably here when she gets her license.
Fantastic. Fantastic.
So these are some of our these are actually the 6 exam rooms that we use. And my team is just kind of like wandering around. This is Andrew. He's one of our LVNs.
Hi, Andrew. So I'm good. How are you?
Good.
So how long have you worked here in the Orange Clinic?
Almost a year, I think. I started during the monkeypox vaccines.
And what was it like for you when the Orange Clinic opened in their beautiful new space and you got to transition the services over here?
Oh, it's nice because then you get all the exam rooms are a lot better. There's more room. We all have our own room, so it's good. It's nice.
And what inspires you to do this sort of work?
I've always worked in the community. I'm also a sister, so I've been a sister for 11 years. So
Meaning Sisters of Perpetual Indulgence. And what's your sister name?
Sister Chaos.
Sister Chaos. Well, it's very organized around here.
Yeah, it's good. So I'm still in the community, so it makes it good.
And how is it to work for an agency like DAP Health that has such a diverse workforce and is so LGBTQ friendly and inclusive?
It's good. It's good to know that we're all treated the same. It doesn't matter, what our sexuality or our gender is. We're still, they take care of all of us.
True for employees and clients.
Yes.
Well, thank you. Nice to meet you, Andrew.
And here we have Anna. She is one of our 3 nurse practitioners.
Hi, Anna. It's so nice to meet you. So, how long have you worked for behavioral health?
Well,
Actually, this isn't behavioral health. I was interviewing them earlier. So, how long have you worked for the Orange Clinic?
I have been in the Orange Clinic for a year.
And what motivated you to get into this work?
Oh, well, we just have a community need, and it's one that I can fill. So we got to take care of everybody. So that's what.
And describe the sense of relief that your clients feel when they can access this care.
Well, we are a judgment-free zone, so to be able to walk in and talk about what they need and what they've experienced and what they need treatment for, it's an open book. It's an open environment, and we take care of them that way.
And what do you think of this brand new space?
It's beautiful. We love it. We're very happy here.
Well, it's wonderful to meet you. Thank you.
All right. So this is another one of our exam rooms. This is Michael. Michael is one of our RNs here.
Hi, Michael. Nice to meet you.
Likewise, thank you.
So how long have you worked here in the Department of Sexual Health?
For over a year now. This past month was my official 1 year here.
And what inspires you to do this work?
I just enjoy doing public health nursing. I've been doing pretty much bedside nursing for the past 10 years. So I wanted to branch out into away from bedside nursing into outpatient nursing.
And what is some of the feedback that you get from people that come and see you about the services that you offer?
We're a great clinic. A lot of our services are free here, and we don't judge, and we try to assist as many patients as we can here at the clinic.
Well, it's nice to meet you, and thank you for your service.
Thank you.
All right. And our last two exam rooms. This is Johnny, another one of our RNs, and this is Ronnie. She's another one of our LVNs.
Well, let me talk to Johnny and then Ronnie. I know Johnny. It's great to capture you on camera. So you've worked at DAP Health for quite some time.
No, just for 10 months. My husband's worked here for 4.5 years.
Oh, okay.
10 months.
And how do you feel being able to work in this particular clinic?
I love this clinic. I like what it stands for. I like the clients. I like everybody who works here. It's a great place.
And describe some of the feedback you get from the people that you serve.
Most people are very happy with our services. They like that they can come in and get it for free, that they can get full STI screening and treatment, and lots of PrEP, and we help people who are newly diagnosed HIV too. I hear like 99% of patients are very happy here, absolutely.
So you're satisfied when you leave for the day knowing that you've really provided a valuable service?
Yeah, I really enjoy my job here. I was an ER nurse previously, but this is a lot of fun and where I hope to retire from.
Is there anything you want to add?
I have a great boss. His name is Mark DiGiornette, and he makes it a good place to work as well.
Good addition. Thank you so much.
Thank you.
I'll pay you your $50 later. And Ronnie had to go take a patient call, so
Okay,
she's
good for her.
available.
Good for her.
Patient care comes first.
So before I let you go, I'd love to dive a little bit more deeper into the services that you provide here. So you have free HIV testing.
Correct. So we have, we do the full spectrum of sexual health testing. So obviously HIV testing, which is how the doc originally started some 4 or 5 years ago. And then they added full STI testing. So we test for chlamydia, gonorrhea, syphilis. We do Hep C testing. And then we're slowly adding some other services. We're also doing pregnancy testing. So we're kind of not just growing the business and seeing more patients, going from 20 patients a day to 40 patients a day, but we're expanding some of our services related to sexual health.
Okay, and by the way, most services are free, and
All
they have
services.
all
from
services.
All services, and the 2 sexual wellness clinics here in Palm Springs and in Indio are free of charge. And if it's a PrEP patient, so we also do PrEP and PEP.
And what is that
PrEP
for people that don't know?
So PrEP to prevent HIV, and also PrEP for patients who want to go on Doxy PrEP, which helps protect against syphilis and chlamydia. We also do PEP, which is post-exposure. So if a patient had an exposure and they're concerned about being exposed to HIV, within 72 hours of that exposure, they can come in, get them on medication. And there's also Doxy PEP, which is used as post-exposure for preventing syphilis and chlamydia and potentially gonorrhea. So all of that is free. All of the lab work that's done here in the clinics is free. If a patient has to have their lab work done at LabCorp or some other lab because they're out of state or out of the city, because we have patients who are from out of state, then they have to cover that. But if they do their lab work here, it's all on us. And any treatment that is necessary that we do here in the clinic is also free. So anything that is done here in the clinic is free of charge to all of our patients, regardless of their ability to pay or not.
And I know that you expanded into Indio because there's a lot of people. One of the things DAP Health is really focused on is healthcare equity and access to care and accessibility. So you have the new Indio clinic, and it's been pretty busy since it opened.
Right. Yeah. It's it's like anything new service that you provide in a new area. So it's growing, and they're getting busier every day. And yeah, reaching out to the communities that are underserved is a big part of DAP Health. So it only made sense for the sexual wellness to move, into areas that are underserved. And obviously the East Valley, we didn't have a presence, so we now have a presence down there.
So clearly for STI testing and diagnosis, you actually need to be able to see the patients. Are you able to offer PrEP via telehealth, or do you need to have in-person appointments with people that you provide PrEP to?
At this point in time, PrEP for HIV, well, any of our PrEP programs, the patient does need to come here. Because we do need to do STI testing as well as blood work to monitor the medication that they're taking. So it does have to be an in-person visit. It's not always with a nurse practitioner. Sometimes it's just with one of the RNs. So usually it's every other visit is with a nurse practitioner, and then every other visit is with an RN. But all of the services performed here are free. Including the PrEP, and then our PrEP navigators will assist clients with either getting their PrEP medication for free or at an extremely reduced copay.
And for those of you who may not know the details, basically PrEP stands for pre-exposure prophylaxis, and when someone is HIV negative and begins to take the medications that are classified as PrEP, if they follow those instructions and use the medication as directed within a very short time, they are protected against HIV. Did I say that correctly?
Absolutely. Yep.
And also, I'm a person living with HIV, and I have an undetectable viral load because I'm successfully treated with antiretroviral medications, which means that it's scientifically impossible for me to transmit HIV to my sexual partners, which is what U equals U means. Undetectable equals untransmittable. Did I say that correctly?
Absolutely.
So once again, if you go, well, not once again, I'm saying this for the first time. If you go to daphealth.org, there's a prominent link on the homepage for sexual health services, in which you can find both the Palm Springs and the Indio locations. Is there anything you would like to add to our tour and our various conversations that I've had with your staff?
Just that we're really proud, and especially me as a gay man, to be able to give back to the community. We see people regardless of their sexual orientation. That's, we're
equal opportunity.
Equal opportunity, yeah. Equal opportunity clinic.
And it's free.
And it is free. So it's kind of, to me, it's really fulfilling to especially give back to the community. It's an amazing space. We're trying to beef up the staff so that we can actually do walk-in appointments rather than people having to schedule appointments. We're not there yet. We're seeing 40 patients a day, and those are scheduled patients. So we're hoping to sometime in the near future be able to have a walk-in line where people could just come in and get tested. But we're not there yet. So just, keep your eyes open, and you'll see a lot of changes with not just with DAP Health, but with our sexual health as well.
Well, thank you very much, Mark. I really enjoyed the tour and meeting your staff, and I love it when I get to do an organic, non-stop, continuous tour on a single take. I just think that reveals a lot more about the space and the people.
Absolutely.
So thank you for helping me coordinate that.
You're welcome.
And as he mentioned, at this time, you do need appointments to come access the free services here at the Orange Clinic and at their other location in Indio. Check out daphealth.org for more information. With Mark Desjarnette, I'm Nicholas Snow. You've been watching a special edition of PromoHomo.TV. I'll see you next time.
Bye.
Thanks again. Really appreciate it.
safe place, I got room to breathe. Been a long chase, but at last I'm free. These open woods, I knew I could find peace here. Nothing like the city where I got tired of the running, the catching up. I got hungry for the